This is Dr. Michael Cameron, and this is the Registered Behavior Technician Module 16. The specific strand this comes from in terms of the Registered Behavior Technician task list is D01, and that is the category for behavior reduction. So we're going into to a brand new category at this point. We're beginning the Section D in terms of the task list, and just more evidence of your own personal advancement. The title of this presentation is to identify the essential components of a written behavior reduction plan. The duration of this presentation is 60 minutes, and there'll be a competency-based quiz at the end, 5 questions. With respect to demonstration recommendations, I'd suggest at the conclusion of this training, you ask your BCBA supervisor to show you a copy of a behavior intervention plan that they've developed. You want to look at the format that they've used. You want to read through the plan. You want to make sure that you have a good grasp of the requirements as dictated by the plan. Now, one of the things I want to remind you of, because we've gone over some of the requirements in terms of the field of behavior analysis, one of the requirements is what's referred to as technological, and we have an obligation. I have an obligation as a board-certified behavior analyst to make sure that I am what's referred to as technological, meaning that I can document procedures with enough clarity and with enough transparency so that a person reading the plan is able to implement that plan. And when we're able to achieve that, we say that we have been technological with respect to our presentation. So you'll want to take one of the plans that your BCBA supervisor has developed, preferably for an individual that you'll actually be working with, and for you to read through that plan to make sure you have a good grasp of what the requirements are. Next, I recommend that you review each component of the plan that the BCBA has included in their behavior intervention model, and then demonstrate your ability to implement the plan following the appropriate training by your board-certified behavior analyst. Your training may involve role-playing, it may involve verbal quizzes, written quizzes, and a verbal description of the components of the plan. That is your verbal description of the components of the plan. So in the field of behavior analysis, we're extremely interested in what's referred to as competency-based training, meaning that we have to train you well enough as a registered behavior technician so that you're able to implement plans according to the model that was provided to you. Now, with respect to the specific module goals, my first objective is to describe a behavior intervention plan. Second, to describe the process for developing a behavior intervention plan. Third, to identify the essential components of a behavior intervention plan. So essentially I'll be describing the anatomy of a plan and what it looks like when it's well developed. And fourth, to discuss the aesthetics of behavior intervention. And then finally to discuss quality control and quality assurance. Now, one of the things that's interesting in terms of your training as a registered behavior technician, we are really relying on you. We, meaning board-certified behavior analysts, are really relying on you as a member of our behavior analytic community. We're relying on you to be an ambassador, relying on you to take responsibility for quality and to give feedback to individuals if you feel that the standards that are being followed are not in line with those of the Behavior Analyst Certification Board. For that reason, I want to give you some tools that you can use to evaluate the quality of a plan and for you to essentially conduct your own quality assurance check on plans. And then if you get to the point through your own advancement in terms of your academic progression and your professional development, if you get to the point where you become a board-certified assistant behavior analyst or a board-certified behavior analyst, you'll be designing plans and you'll have this quality control checklist one of which I'll share with you for the purpose of your own self-monitoring and quality assurance guidance. Now, with respect to the names of the plans that you'll be using, there's a number of terms that are used, and I just want to give you some exposure to those terms because I think it's important. Some individuals will refer to the plans that have been designed to address problem behavior. They'll be referred to as behavior intervention plans or BIPs. Other folks refer to them as behavior support plans. And then still others refer to their models as positive behavior support plans, or PBSP. One of the things that I would like to point out to you is that if you're claiming you are implementing a positive behavior support plan, that term has a very specific meaning. And that term carries with it an obligation to honor and subscribe to the philosophy and the elements of positive behavior support. It's not a term that is used loosely. It is a term that has very specific meaning, and I just want to make sure that you have some clarity with respect to that. I'd like to introduce you to Dr. Ted Carr. His picture is right here. Dr. Ted Carr was an internationally recognized pioneer in autism treatment research, and unfortunately he died in 2009. But he's somebody that I knew, somebody that I have enormous respect for, and he made a number of incredible contributions to the field, one of which is this paper entitled The Expanding Vision of Positive Behavior Support. And within this paper, he gives a really good overview of what positive behavior support is, and he emphasizes the necessary elements and components of positive behavior support if you're claiming you're using a positive behavior support approach. So I tell you all that because I just want to make sure that you have a high level of precision with your language and with the terms that you're using as well. One of the things that I had pointed out to you in one of the earlier modules is that Skinner had a very keen appreciation for the use of language and the way he described things, and he really admired people from other scientific branches and emulated them in his own work, in his own research, and in his own coining of terminology. So I want you to essentially adopt the same standard. If you're going to use terms like positive behavior support, I want to make sure that you understand what it means. I want to make sure that you have the necessary resources to expand your knowledge and familiarize yourself with these various aspects of behavior analysis. And the more you're educated, the better you will be in terms of your position. So in a previous module, for example, I talked about precision teaching and standard acceleration charts and the Standard Acceleration Society. And I just want to make sure that if you want to develop your own interest, or if you want to use those terms, or if you're going to make assertions that you're taking that kind of approach, that you are well anchored and grounded in the exact science and in the philosophy of those various branches of instruction, or in this branch of behavior analysis that is positive behavior support. So don't use the words loosely. They have very specific meaning, and I just want to make sure that you have good familiarity with the terms if you choose to use them. Now, a behavior intervention plan, that's a term I'm going to use throughout this module. It's more neutral. The behavior intervention plan, by definition, is a plan that's developed by a team. And one of the things I want to underscore right here is team. And that involves the family. It involves many times the client, if that person has the capacity to contribute. If you're working in a school-based setting, then it's going to involve the teacher. It's going to involve other stakeholders in that school as well. Perhaps some of the other general education teachers that may come in contact with the individual who you're serving. If you work in a clinic-based setting, the team will involve perhaps a speech and language pathologist or an occupational therapist or physical therapist. If you work in a hospital-based facility, the development of the plan may involve a nurse. It may even involve a psychiatrist or a physician. Those are stakeholders as well. So the plan is developed by a team of individuals. These plans are not done unilaterally. They're not done without the consultation, without the input of other important stakeholders in the entire process. So I underscore that. It's also the result of a functional behavior assessment or a functional analysis. So that is the driver. The FBA, the functional behavior assessment or the functional analysis process, is the driver in terms of how a plan is developed. Because as you recall, we have to understand the function of behavior. We have to understand what the function of a problem behavior is before we can develop a plan in order to address it. So once again, I'm just going to remind you, we talked about the various functions of behavior. And I gave you that mnemonic device, SEAT. The behavior may be motivated by sensory consequences, may be motivated by escape and avoidance, may be motivated by attention, may be motivated by tangibles that the person's coming in contact with in the environment. So that information, the hypothesized function of behavior, can only be derived as a result of conducting an FBA, or more definitive notions about the function of behavior can only be derived as a result of doing more of an experimental analysis and conducting a functional analysis. So that piece must be in place. The FBA has got to be done. The functional analysis, if that's a route that your board-certified behavior analyst goes, that must be done prior to the development of a plan, because it is the foundational part of a plan. And then at a minimum, the plan that is developed for the individual based on the FBA or based on the functional analysis, the plan will include first a description of the problem behaviors. So once again, I'm going to remind you about some of your previous training here in the modules. We have an obligation to provide operational definitions of behavior. We need to ensure that we have clarity and completeness in terms of our description of behavior. So that's going to be part of this plan. You will get a clear sense as a result of reading the plan what behaviors are being addressed, what issues are being addressed, and you'll have clear definitions that you can work from. It's only through the clear definition that you get good consistency and good procedural reliability as a result. Also, at a minimum, the plan is going to include a hypothesis as to why the problem behavior occurs. When we do a descriptive assessment in FBA, for example, we can only derive from that a hypothesis because we haven't done experimental manipulations. However, if we did do a functional analysis, then we can be more definitive in terms of conclusions about how the behavior is functioning. And then finally, you should have a comprehensive intervention strategy mapped out for you in the plan as well. So to recap, at a minimum, it includes a description of the problem behaviors, hypothesis statement in terms of why the problems are occurring, and then a comprehensive intervention outline for your review. Now, once again, one of the things that I want to emphasize is that the reason the behavior intervention plan is being developed in the first place is because the person's aberrant behavior or problem behavior serves as an obstacle to their development, their performance, their inclusion, and their capacity to advance in terms of their own skills and abilities. So maladaptive behavior, problem behavior, becomes a challenge and an obstacle for an individual. So for that reason, we are developing a behavior intervention plan to address those issues and to try to give the person alternatives in terms of the way to behave, and rather than resorting to things that become problematic for them in the long run. The other thing I want to emphasize is that behavior intervention plans go hand in glove with skill acquisition programs, because we always have to be focusing on the development of skills and teaching new skills and expanding a person's repertoire, because it will ultimately be the good skill base of the individual that competes with the problem behavior, and they go hand in glove. A behavior intervention plan goes hand in glove with skill acquisition plans. Now, with respect to the types of behaviors that will be targeted for decrease in plans, there'll be behaviors that produce attention or the delivery of desired items. So, for example, a person may engage in maladaptive behavior because they're attention seeking. And I just want to remind you, when we're talking about attention, it could be non-verbal in nature. It could be eye contact. Eye contact can serve as attention. It could be verbal in nature, where a person's words could function as a form of attention for the individual. Or it could be physical in nature. A person may engage in particular behaviors in order to get some kind of physical form of attention. So it could be verbal, non-verbal, physical in nature, and that's what I mean by attention-seeking behavior. Or if the person's engaged in some problem behavior for the purpose of acquiring desired items, they may be tangibly motivated. And that kind of person is relying on and looking for socially mediated reinforcement. And you remember the good definition of that, right? Socially mediated means orchestrated, organized, and facilitated by another person. That's what socially mediated means. So that's one class of behaviors that will be targeted for decrease. Another class is behavior that allows a person to avoid or escape demands or other undesirable objects or events and circumstances and activities. So this is a person that may be escape and avoidance motivated. So we design plans in order to give the individual an appropriate way of acquiring that kind of outcome. And then there'll be a plan in place in order to decelerate the problem behavior that results in that outcome. And then third, you'll be addressing issues and behaviors that occur because of their sensory consequences. And we refer to that as automatic reinforcement. So those are the kinds of behaviors that you'd be targeting for decrease. What specific names do they have? Well, it's quite diverse. You may be addressing things like aggression. You may be addressing something like self-injurious behavior or elopement, a person wandering away, leaving without permission. You may be addressing non-compliance, a person's lack of cooperation. You may be addressing something like property destruction, for example, or self-injurious behavior, for example. So there's a wide array of problem behaviors that are addressed through a behavior support plan. And then once again, what goes hand in glove with this is that you are targeting things for decrease, but on a simultaneous basis, you are targeting behaviors for increase. Now, one of the things I've mentioned previously, and I'll say again and again and again, is that problem behavior is a form of communication. Problem behavior is often a solution for an individual. It presents a problem for us, but really it's a solution for the individual. So individuals often tell us something through their behavior. They communicate with us through their behavior. So in consequence, it makes sense here that one of the behaviors that would be targeted for increase in a behavior intervention plan would be communication skills and language skills. We often talk about teaching functional communication and using a functional communication training to give that person an option for using communication or using language in place of the problem behavior, in place of the maladaptive behavior. So this has got to be part of your plan. There's got to be a goal and objective for accelerating the individual's communication and language skills. Now, when I say communication, you will be working with a wide range of individuals. There'll be folks that you work with that may be nonverbal, so therefore their communication may take the form of picture-based communication, or they may be using the Picture Exchange Communication System, also referred to as PECS. Some of the individuals may be using assistive technology. Some people may have devices, technology devices, for example, for the purpose of communicating. Some people may be using text-based communication, where they're pointing to words, for example, for the purpose of communicating because they don't have any capacity for voice output or language output. So communication takes a variety of different forms, and as a registered behavior technician, you will come in contact with a wide variety of individuals with very diverse capabilities in terms of the form of their communication. So some of the individuals may be using a picture-based system or assistive technology, and others will be perfectly fluent with respect to their communication skills and their language skills. But you will be targeting that for increase. You'll also be targeting academic skills and the improvement in academic skills. What academics? Well, reading, writing, mathematics, for example. For those of you here that will be working in school-based settings, the academic focus is perfectly appropriate. For other individuals who are working exclusively in home-based settings, you may not be working on any academic skills at all because the funding source, for example, an insurance company, does not allow for you to be addressing what should be addressed in school. But your BCBA supervisor will give you clarity with respect to that. Just make sure that you understand what is allowable and what is appropriate to be focusing on depending on the context in which you're working with an individual. So for those of you, once again, that are working in schools, you will be focusing on academic skills. Another category of behavior for and targeted for increase is social skills. This cuts across every setting that you could possibly work. It doesn't matter if you're in the community-based setting or a school-based setting or a home-based setting or a clinic-based setting or a hospital-based setting. Teaching appropriate social skills is critical. And social skills can fall into the category of nonverbal and also verbal. There's a number of things that an individual has to be explicitly taught in order to integrate appropriately into their culture and into social situations. So that's a class of behavior that's also targeted. Another class is conflict resolution skills, especially in home settings where there's conflict with siblings, for example, or in the school-based setting where there's conflict with peers, other students in the school. Teaching very clear conflict resolution strategies may be something that you'll be focusing on. And then once again, I'm going to remind you, I've said this numerous times through the modules already, but you'll also be teaching the individual to self-manage and to use self-control skills. You'll be getting that person involved in their own management. You want to promote their own independence. You want that person to be operating and functioning in the school environment, for example, as independently as they possibly can. You want that person functioning in their home setting as independently as they possibly can. So for that reason, when a person has the capacity to participate, when they have the capabilities of assisting with data collection, for example, or using self-management strategies and self-control strategies, that becomes something that you will teach them. These are things that can be explicitly taught. These things benefit the individual, and you'll spend time on that skill set as well. So by way of summary here, behaviors for reduction, those that are producing attention or delivery of desired items, somebody that's tangibly motivated, also behaviors that result in escape or avoidance, and behaviors that result in sensory consequences, automatic consequences. Things you're looking to increase: communication, 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 communication. Boy, I can't emphasize that one enough. and language skills, and academic skills, and social skills, conflict resolution skills, self-management skills. Those are the things that you'll be targeting for change through your behavior intervention plan. Now, with respect to the process for this whole endeavor, in terms of developing a behavior intervention plan, the very first step in this process is identifying and building the team of individuals who will design the plan. So for that reason, you'll be identifying the key stakeholders. That includes family members. That includes, again, if you're in the school system, the individual education program team, also referred to as the IEP team for the school-aged individuals. And then key members of disciplines that are wrapping around this individual. People from medicine, for example. I've had physicians that were part of my development process. I've had nurses that have been part of the development process of behavior intervention plans. And certainly speech and language pathologists a lot. Occupational therapists, physical therapists, social workers, school psychologists. So those will be the people that will comprise a team. Your BCBA will not do this unilaterally. They will not do it without input, and they certainly won't do it without the input from the family. All these key stakeholders need to be involved in the process of developing the behavior intervention plan. And then for that reason, one of the things that will be essential is that you establish rapport with these team members, and you confer respect, and you recognize their role, and you honor their role, because it's only through good rapport and good collaboration and good communication with a team that you're able to make very good things happen. And one of the very good things that you want to have happen here is the production of a behavior intervention plan for the benefit of the individual that you're serving. Now, in building the team and in planning to begin this process in terms of developing the behavior intervention plan, one of the things I want to remind you of is to maintain sensitivity to the context in which that individual will be treated. There is an ecology. There's an ecology of education environments, and there's an ecology within a home. And the interventions and what those interventions look like will matter. And the way you interact with the person will matter, because you are doing that. You are treating an individual. You are engaged with them, and using a behavior intervention plan within a context. And that context will be affected as a result of you. It will be affected as a result of the interventions that you're using and the plans that you put in place. So always maintaining sensitivity to the environment in which you plan on implementing the plan, whether it be a home, a clinic, a school, the community. That's for you to consider. The other thing that that's important in terms of working with the team and working as a professional in the field is that you're committed to your own evolving growth and change. That means to be a flexible thinker. You have a lot to learn. I learn every day, and I really thrive in terms of those opportunities. So you have to maintain an openness with respect to perspective and discussions and learning. And you can learn a lot from the speech and language pathologist, a lot from the school psychologist and the physical therapist and the nurse or the nutritionist or the social worker. So you're constantly absorbing new information and assimilating that information, and that results in your own evolution as a professional, is to maintain that openness and to maintain that collaboration and that communication. And then finally, and this is a critical point, make sure that the goals that you end up coming up with are mutually shared. They cannot be goals that are desired by one or two people on the field, on the team. It's got to be it's got to be an agreement. There's got to be mutual agreement that the goals that have been identified are the valued goals. Because if you don't have good cooperation, and if you don't have agreement in terms of the goals of the plan, then you can hardly expect to get good consistency and good follow-through with respect to that plan. So step one, in terms of developing the behavior intervention plan, build the team. And that will be your board certified behavior analyst's responsibility, but you'll be part of that team, and you want to make sure that that there's good inclusion in terms of other stakeholders, family, other disciplines, other people from the person's wraparound services that will have something to say and have an opinion about their behavior intervention plan. The second recommendation, and I've said this so many times through this module, know the individual's strengths. It is through the identification of their strengths and interests that you're able to develop a really good behavior support plan. And people will surprise you with respect to their strengths, and it'd be very important for you to go through the process of acquiring that information so that you can wrap the plan development around the individual's strengths. The third component is to complete the functional behavior assessment. This is something that you'll do in collaboration with your board certified behavior analyst supervisor. I said at the beginning of this module, and I'll repeat it again, the FBA drives everything. We need to know the function of behavior. We need to understand the motivation of the behavior and why it's occurring before we can build a plan. And then once that FBA is complete, we're moving on to the fourth part of developing a plan, and that's developing the hypothesis statement. We're saying that we believe this behavior is functioning as a way for the individual to acquire attention, or we believe that the data is suggesting and that our FBA results are suggesting that the individual is motivated by his or her ability to escape or avoid demand situations. So that hypothesis statement is critically important. Next, you're actually developing the behavior intervention plan, and we're about to go through what that exactly looks like from a documentation standpoint. But once you've completed these first four steps, that's where you're going with it. You'll document the actual plan and put that down on paper, and it'll be shared with the other team members. And then once it's implemented, you are in the process of monitoring the results. So one of the things that you will have done with the BCBA supervisor is to collect baseline data on all these target behaviors that we've been talking about, right? So you got baseline data on aggression, you got baseline data on self-injurious behavior, or property destruction, or non-compliance, or elopement, for example. You also have baseline data on the person's use of their communication, language. You got baseline data on their academic skills, their social skills, their conflict resolution skills. So once you have the baseline data, and once you have your plan complete, and you implement that plan, well, then you start monitoring the results. And what do the results look like? Well, that depends on the data collection system that you put in place, right? Now, you know all about the continuous data collection methods, the discontinuous data collection methods, and permanent product data collection. So you may have many of those things in place, and you may have identified various data collection procedures for the purpose of verifying whether or not the person is actually making progress. So you will work with your BCBA supervisor in terms of determining what the best measurement system is. So with respect to the anatomy of a plan, that plan will consist of teaching strategies. You'll be explicitly teaching behaviors and skills that result in the same outcomes as the target behavior. Let me give one example there, and this is a fun example for me. It occurred in Boston Public Schools in a very difficult school system in Boston, Massachusetts. And I worked with one individual in a middle school, and it was an inclusionary classroom, and this individual had the capacity to disrupt that entire culture. On a daily basis, he was seriously disrupting the class with his problem behavior, use of expletives, arguing with other students and peers, arguing with the teacher, property destruction, tipping over desks, destroying pencils and other academic products, for example. This was something that was going on a regular basis. And one of the things that I did, of course, was that I completed the functional behavior assessment. And one of the things that I found was that he was attention motivated. Specifically, he really desired the attention of his peers, typically developing peers, and to some extent, he desired the attention of the teacher as well, but more so the peers. So one of the things that I did with him was that we identified a topic. The class, by the way, that I was doing the consultation for was a science class. So we identified a topic, and it was a science topic, and we told this individual that he would be the expert in terms of this topic, and then we would give him special instruction in terms of learning about the various forms that liquid could take. And he studied the various forms, and he became an expert in discussing the various forms. And then as a result of that, we told him that he would be the teacher, that he would be able to take control of the class, and that he would have a 1/2 hour session where he would teach all his peers about the various forms of liquid. And he would do that, providing his behavior was appropriate leading up to the event, and providing he put together a PowerPoint presentation and developed a lesson plan for the purpose of teaching. Why did we do that? Well, because this individual really wanted the attention of the peers, and he would do so and get it in a problem way, in an asocial way. So we wanted to flip it and to make it pro-social, and to make him become somebody that was looked at in a different way by his peers as a result of having expert knowledge and information. And that's exactly what we did. We made the presentation to the class contingent on demonstration of his appropriate behavior. We explicitly taught him skills to have him become an expert in one particular knowledge area about liquids. We taught him how to use PowerPoint. We helped him develop a PowerPoint presentation, and we finally got him to the point where where he was able to do that for the class. This did not occur on one occasion. This occurred on multiple occasions. We did this over and over and over again with him, and it completely shifted everything for him. It resulted in his retention in the school because he was at risk for being expelled. It shifted his social opportunities in the classroom because once he began doing this, the students began responding to him differently. And one of the other things that I did was to put in place a self-management process for him, where he was recording his own behavior, his own appropriate behavior, and the inappropriate behavior that was occurring. Then at the end of the year, I brought him into the university where I taught, and I had him do a presentation on his own behavior to an entire graduate class. So all master's levels, individuals studying to become board certified behavior analysts. I had him do the presentation regarding his own strategies, his own self-management, his own results, and it was an amazing experience. I remember him showing up for the presentation. He had borrowed a suit from his uncle, and the sleeves were too long, and they were cusping over into beyond the palm of his hand. But this individual was so proud to be there, and so proud to talk about how he shifted his own world and shifted his own standing in the school setting. So you're teaching conflict resolution skills. You're teaching skills that will allow that person to shift their circumstances from a behavioral standpoint. So for that reason, as part of the behavior intervention plan, teaching strategies are integrated. The other thing that's integrated is what's referred to as setting event strategies. And these are strategies that address factors that may set the occasion or set the stage for a challenge in behavior. It could be a medical issue, for example. We often talk about biological setting events, things that are influencing the individual as a result of their biological functioning. Anybody here, for example, that suffers from migraines, anybody here that may have celiac disease, anybody here that may have colitis, or some kind of gastrointestinal problem, anybody that may have gastroesophageal reflux disease, GERD, for example, those people here that have migraines, that have GERD, that have the reflux, that have colitis, that have various types of gastrointestinal problems, for example, that your physical being and the sense of well-being from a physical standpoint will impact your behavior. So for that reason, we're always looking at setting events and things that may address, that we could address, that will be influencing the person's challenge and the behavior. And we need to be addressing those issues many times with the medical community in order to ensure that those things are not factors any longer. The next category is what's referred to as antecedent control strategies. These are changes that we're making to attempt to neutralize or eliminate events that are triggers for an individual. And there's a number of things that can be done, and once we get to the module on antecedent control strategies, we'll get an entire host of ideas with respect to what can be done from an antecedent control standpoint. The plan will also involve consequence control procedures, procedures that you'll use as reinforcement contingencies, for example, for increasing appropriate behavior. Also within the plan, there'll be what's referred to as safety net strategies. The plan should include a safety plan. The behavior intervention plan, that is, should involve a safety component if the individual has a history of putting themselves or others at risk, for example, due to elopement or self-injurious behavior. Finally, there'll be information regarding the implementation of a plan. That will be an outline of who will implement the plan, how they'll be trained to implement it, how the plan will be reviewed and shared with stakeholders as well. Finally, the monitoring strategies will be outlined. There's your data collection. So you'll be monitoring through a frequency count or rate or duration or latency or interresponse time or partial interval recording or whole interval recording or permanent product data. All of those things will be mapped out and identified in terms of how you plan on going through this process of monitoring. And then finally, there'll be a section for generalization and maintenance of behavior. The plan for generalization must occur at the pre-planning level. We start planning for the generalization of effect right at the very beginning. It doesn't just happen. We're constantly putting thought into that outcome and planning accordingly. And then the final thing I want to say is that there's got to be a keen eye on the aesthetics of the plan, just exactly what it looks like to others and how it presents. I love this quote by Steve Jobs. He says, "For you to sleep at night, the aesthetics, the quality has to be carried all the way through." So I submit that this quote applies as well to the development of behavior intervention plans. If I'm going to sleep at night, then I know that the aesthetics of my plan and the quality of the plan has to be carried all the way through. So a great quote that I share with you. Okay, so this is what it's going to look like. This is just one example. One of the things that I did was to take a really clean presentation and to offer that to you, just so you can see an example of what a behavior intervention plan looks like. So here we have a place for the name of the student, for example, the student identification number if required, date of birth and date of the plan, the grade, if you happen to be working with an individual in the school, the name of the parent and guardian, for example, is also there. Okay, so one of the things that you'll notice is that in the very beginning, in terms of the behavior intervention plan, we're mapping out our sources of information. So we list the sources of information we use for the purpose of the FBA, both formal and informal sources. Now, one of the things I want to mention here in terms of doing an FBA, that many families, for example, and many professionals spend a lot of time and a lot of resources having assessments done. So if an individual had a neuropsychological examination done, for example, or some form of learning assessment done, or if there's been a medical workup on a person, or if the speech and language pathologist has done a very thorough report, then the BCBA that's working with you has to ensure that they've read that information. Families can pay thousands and thousands of dollars for a neuropsychological evaluation, and those evaluations are done for the purpose of informing other individuals that are working with the individual. So for that reason, on a behavior intervention plan, you're identifying your sources. You're indicating, yes, I've read the neuropsychological eval. Yes, I've read that discharge report from a hospital as a result of a short-term admission and perhaps a psychiatric admission and an evaluation. Or I read the report from the attending psychiatrist, the individual that's treating the person from a pharmacological standpoint. So the point here is to be informed, to list your sources. What informed the FBA? List it, map it out, just so that all team members know that you and the BCBA cared enough to be looking at these other evaluations for the purpose of developing this plan. The next thing is the strength-based piece. Identify the skills and interests and the positive relationships the person has, the pro-social behaviors that are already exhibited by the individual, what family supports they have, community supports. Could be individuals from a religious association, a church, a synagogue, for example, that may be very caring about the individual. All those things become strengths. And all those things can be mechanisms for really assisting a person to make progress in their life. So that should be listed. Third, in the third category here, you're actually doing a summary of your FBA findings. So the functional behavior assessment summary statement should describe the specific problem behavior and the summary of your hypothesis in terms of why the behavior is occurring. Or if you happen to have done functional analysis with the individual, you can make more conclusive statements about function. But you're making hypothesis statements about function if it was just a descriptive assessment that you did. From there, in the fourth part of the plan, we have the specific strategies and outcomes that we're looking for. Those are delineated. So what are your strategies from a setting event standpoint? What are you doing? Are you working with a physician, for example, to address the gastrointestinal problems? Are you working with a neurologist, for example, to address the migraines? Are you working with a nutritionist, for example, in order to address the person's nutritional status and perhaps their eating behavior? Are you working with an occupational therapist, for example, to address issues centered on the person's development of various motor skills where they may have deficits? So all the setting event strategies are listed. And then all your antecedent control strategies are mapped out. And then your behavior teaching strategies, what you're doing to teach alternative behaviors. Do you have a functional communication training process in place? Are you using the picture exchange communication system? Are you teaching the individual to use good communication as an alternative to the maladaptive behavior? And then finally, you're mapping out your reinforcement strategies. you're listing out all the behaviors that are been targeted for increase, and you're describing the consequences and the contingencies that you're putting in place in order to accelerate the kind of behavior that you desire. So this is what your plan looks like. It gets mapped out here. And then in the fifth section, your crisis intervention, what I also refer to as a safety net intervention, is identified. Then in the sixth section, you're indicating how your plan will be evaluated. Indicate what will be measured and by whom. Identify the desired performance level that you're looking for in terms of your goal and objective. And identify your monitoring method, your data collection responsibilities. Identify who the person is that's responsible for collecting the data and also graphing the data and displaying the data, and what your criterion is for success. You have to indicate that at the very beginning. The next thing you're doing in the plan is identifying whether or not the plan is a cultural fit. I've already spent a fair amount of time discussing this, and you want to make sure that the plan is sensitive to the culture in which the plan will be implemented. And then finally, you're identifying how to communicate with the behavior intervention team, who should be contacted to inform them of this plan, how they'll be contacted, who the person is that's responsible for doing that contact, and who will communicate revisions and updates of the plan. All these things have to be choreographed. All of these things have to be mapped out in advance, and there's got to be clarity in terms of who's responsible for what before a behavior intervention plan is responsibly implemented. And then finally, you're outlining all the team members. So remember, I talked about building the team and identifying the team. Well, the teacher's named, the parents named, the social worker may be named, the school psychologist may be named, and then you're verifying that the parent has been provided a copy of the plan, and they would have given consent already for the functional behavior assessment process, so they'll be expecting a copy of this plan as well. So that is the anatomy of a plan. That's what it looks like. These are the necessary components. So when you are working with a board-certified behavior analyst, this is what your expectation should be. You should have this expectation that you're going to be given a behavior intervention plan that is mapped out as well as this one, that has all the components that are necessary, and they're all mapped out here. And that's what you should expect as a registered behavior technician. This is the clarity of a plan that you should receive. Now I'm going to give you one other tool. I'm going to refer to this as a job aid. And one of the things that I really want to point out is that this behavior intervention plan quality evaluation scoring guide was developed by Diana Browning Wright from an organization referred to as PENT, P-E-N-T. That acronym stands for Positive Environments Network of Trainers Leadership Team. She's done a lot of great work in collaboration with California statewide PENT cadre member network. And I give you their web address down here as well. But I just want to recognize her work here because one of the things that she did was to provide just an excellent guide for evaluating plans. I'm showing you this for the following reason. As a registered behavior technician, you can take this scoring guide and this guide and you can evaluate the quality of the plan from a board-certified behavior analyst. This scoring guide will allow you to be clear in terms of what the expectations are for plans. You can be clear as to whether or not you received a well-developed plan or not. Because for you, as a registered behavior technician, we want you to take this role very seriously. We always want you to have job aids. We want you to be able to understand what the standards are. We want you to have resources so you can evaluate what you're receiving in terms of plans to implement. And this is just one great guide to be used. So the components, and I'll just go through a couple of them here, but the components include a question as to whether the problem behaviors that have been identified have been described in observable and measurable terms. And then there's a scoring guide here where you can answer the question as to whether or not it was done with great clarity or whether some problems identified with the behavior not being one that's described in such terms that it is observable and measurable, or a complete omission of the information. And then the other thing I like about this guide is that it gives examples of what a good definition looks like, and it reminds you of some of the key concepts with respect to that. So something that I really encourage you to do is to take a look at a scoring guide such as this, and to potentially use it in your role as a registered behavior technician. So the scoring guide is quite extensive, and I'm just giving you a sampling here of some of the things that are in it, but also other components in a plan. The predictors of problem behavior should be identified, and it should indicate whether or not the things in the physical environment are predictors, like sensory overstimulation or noise levels or crowding or temperature. You know, what is it about the social environment that could be a predictor? It could be having something to do with the person's interactions with others. What about the instructional environment? Is there a mismatch between the learner and the curriculum that they're exposed to? Are there scheduling issues? Is there a degree of independence that's not being honored? Could that be a predictor of a problem? You get the idea. You can go through this entire guide, and it will spell out for you just exactly what your expectations should be from a good behavior intervention plan. So I offer that to you as a resource. It's available online and readily available to you with just a couple of clicks on your keyboard. So to conclude, some questions here. What is a behavior intervention plan? Well, it's a plan based on the results of an FBA that includes comprehensive strategies for changing behavior. 3 target behaviors to increase: communication, 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 language skills, conflict resolution skills. What's the first step required when developing a behavior intervention plan? Build a team. Include the family. Include stakeholders: speech and language pathologists, occupational therapists, physical therapists, nurses, school psychologists, social worker. It is a team, it's a collaborative approach. You don't do things unilaterally. You don't design these plans on your own. 3 components of a behavior intervention plan: teaching procedures, setting event strategies, antecedent control strategies. And then true or false, the aesthetics of behavioral arrangements matter. Yes, they do. True. They matter a lot. Thank you once again for your attention, and I will talk to you again in Module 17.